have to look for that little hyperechoic foci. It's called an echogenic foci. I call it a ditzel. Okay?
You said when you see a chocolate cyst?
When you see a chocolate cyst, you have to find the echogenic foci.
Inside?
Because when you see a chocolate cyst, anterior, inferior, lateral, medial, you still do the grid evaluation on it. With and without measurements, with and without color.
Is that a chocolate cyst? So where would
They said that it was.
and where's that echogenic?
It's only an echo, you have to be at that level
Oh.
to be able to see it. Okay? And this is an axial plane, meaning it's coming this way. Okay? Endometrium, myometrium, serosa. These are arcuate arteries. They calcify with age. They calcify with diabetes. Okay? Anterior cul-de-sac, posterior cul-de-sac. Retropubic space. And if this is a sagittal, it's a retroflexed ultrasound. Retroflexed. Anterior, posterior. If it's like this completely, this would be anterior and this would be posterior. Okay? If you can see the bladder and the whole uterus in the same plane, this is anterior, this is posterior. Because anterior stays anterior and posterior stays posterior. Endometrial polyp. What exam did they do to see this? It's an invasive procedure. Because I normally don't have this much fluid unless I have more pathologies. A histosonogram. Okay? I normally don't have this much fluid in my endometrium unless I have other pathologies. What's going to happen without a histosonogram, this layer is going to touch this layer, and I'm only going to see a little triangle here of fluid and a little triangle here of fluid. Okay? Anytime I see a triangle of fluid, there's pathology there. They don't teach that to you in the books. You have to know it clinically. Okay?
So after we see the smaller triangle inside the endometrium,
I'm going to zoom that image, and I'm going to look at that endometrium as slowly and as meticulous as I can, because something's there. I'm going to do my compression, make it more, because I'm a black and white person. I like to see that really high, low contrast. And so I'm going to turn on color, I'm going to turn on harmonics. I'm going to use my machine to be able to define that. I could even do chroma, which changes the color of the anatomy. Have y'all seen that yet? Okay. Because sometimes chroma will help you define anatomy. If you know something's there, do your best to work your machine so you can see it.
okay. And you write in the report, you suspect
Complex endometrium. That's all you say. You're not gonna make a diagnosis. It's not our job to make a diagnosis.
yeah, just I mean how to tell the
Yeah,
doctor.
complex endometrium. Okay? So this is a dilated fallopian tube. Here is an endometrioma, known as a chocolate cyst. It's usually going to be homogeneous. Homogeneous. Here's a fibroma. I know it's solid because look at the striations that I have. Something is causing the speed of ultrasound to stop and go. A fibroma is a solid ovarian mass.
But how can I tell this is ovary or the uterus?
Because I'm gonna know where I'm at. I'm gonna be very, very meticulous when I do my exam. My uterus is gonna be together, my right ovary is gonna be together, my left ovary is going to be together. Okay? And I've already done my uterus. If I'm at my ovary, I've already done my uterus. I know there's no pathology with the uterus. So it depends on if I angle to the right or if I angle to the left. Got it? Okay. But I know it's a solid tumor because the speed of ultrasound has made it heterogeneous. Okay?
So the difference between the fibroma and the chocolate cyst is just the
echogenicity.
yeah. Okay.
Okay? See, I have posterior enhancement.
Yeah.
My mass is, the majority of it is homogeneous. I do have some echoes in there, so the blood's probably settling down. Okay? But look at this. I have posterior enhancement over here, but I don't have posterior enhancement over here. I have posterior shadowing over here. So something's going on here because I use my artifacts to help me make a diagnosis. If this was an endometrioma, I would have posterior enhancement the whole posterior field, but I don't. I have posterior enhancement, I have posterior shadowing, and I have normal. So something's going on. I don't know what it is, but I'm gonna do 9 images of that, or 6 images of that, not counting the measurements of the top.
Long and trend first.
Because I'm gonna do, this is sagittal, so I'm gonna do midline with and without measurements. I'm gonna go medial. I'm gonna go out of it, come right back in and take an image. I'm gonna go back to mid. I'm gonna go lateral. I'm gonna go lateral again, out of it, right back into it, and take an image. So how many images is that? 1, 2,
8.
3, 4. I always do a mid again, so the doctor doesn't get confused. It only takes a minute.
So 8.
Not even a minute, 5 seconds. So anytime I look at something, if I'm mid and I go left, I go back to mid and take another image. I'm letting the doctor know, okay, I'm back at mid, now I'm gonna go lateral. Okay? Because it doesn't cost us anything
Right.
to take that extra image. And we want him or her to know exactly what we're doing. Now, if I'm superior, inferior, I'm not gonna do that. I'm gonna start superior and I'm gonna go inferior. But if I'm sagittal, I have to take that midline shot again. Does that make sense?
Can we do cine loop?
Huh?
Can we do cine loop?
If the doctor's not there, absolutely do a cine loop. Okay? If your doctor's there, you can take a cine loop if you want to get into that habit. It's not required.
Okay.
But if the doctor's not there, absolutely do a cine loop.
Because I saw a lot of tech they do cine loop.
Yeah. Yeah. Oh, That's it?
Reveal. We have time for review.
Mm-hmm. How much time we got left?
25.
Long time. Time for review.
Okay. So MRI Physics. You have a magnetic field. What happens with that magnetic field is it aligns the photons. The photons have a nucleus, okay? And then it uses those photons, it captures them and sends it to a console and takes a picture from that. Okay, it takes a picture from that. It uses electromagnetic radio waves to do this. You're in a huge magnet. It's just a big console with a hole in the middle of it. Okay? It looks just like a CT machine. But what happens with MRI, they put you in a coil. They put you in a coil. Like if they want to look at my breast, they're going to lay me on my stomach so my breast hang down, and they're going to enclose me in a coil. If they're doing a head, they're going to enclose my head in a coil. If they're doing my knee, they're going to put a special coil around my knee. Same thing with the abdomen. Okay? Those coils or those machines go according to the intensity of the magnet. And that is described by Tesla.
What?
Tesla. Just like Tesla the car.
Really?
Yeah. Mhm. Yeah. Like what we have in Harris Health, those are Tesla 3s.
Oh.
Okay? Because it's like the iPhone. You have the iPhone 1 all the way up to iPhone 11. So do you think Tesla 1 is stronger than a Tesla 3? Or is a Tesla 3 stronger than a Tesla 1?
3.
The 3. Because they're getting better with technology.
Tesla 3 is the name of the MRI machine
That is the strength of the magnet.
String.
that the MRI machine uses.
Yes.
Oh.
Mhm. You know, because they've only implemented MRI in the early 80s. So can you imagine what y'all are going to see by the time you're my age? It's unbelievable. I can't even think that far. You know, because we were still using processors to develop film whenever I was in X-ray.
Yeah.
A CT scan, one image took 3.5 minutes.
What?
Now you can do a whole scan in 30 seconds. What's the fastest you think, Patricia?
A whole scan
For a whole scan of my head?
of the head,
Yeah,
about a minute.
yeah.
Whole
That's getting the patient on the table, everything.
1 minute? Wow, that's fast.
Because once you get your scalp done,
Yeah, it's done. When I started doing CT, 3.5 minutes per slice.
So how many minutes for the head before?
Probably 8 on just a transverse. Okay? So the technology that you're going to see during your tenure as a technologist, that's all Jetsons for me. Okay? So, what else can I tell you? Okay, so a CT machine looks just like an MRI machine. The only difference is the coils. This uses electromagnetic waves. And what does CT use? Uses radiation. Okay? So here is a T2. T2 is brighter. Here is fluid inside the endometrium.
T2 is Tesla?
Nope.
No.
T2 is the imaging program that I tell the machine to
Oh,
do.
that's right, the button.
Yeah, it's just a button.
Right.
Okay, it's on the console. The technologist controls that. Okay, it's just a button. It depends on what they want to look at. Okay, so think of it this way. Here's a T2, but look at the muscle. I'm not seeing the muscle very good, am I?
Mm-hmm.
But look at the T1. Okay? So if they're looking for a sarcoma in my butt, this is what they're going to do. They're going to do a T1. Okay?
But looking for the fluid is different.
Yeah, if you're looking for fluid, it depends on if you're T1 or T2, whether it's going to be bright or whether it's going to be dark.
Can you
T2.
explain more about the fat saturation?
Yes. Okay. So I can program my machine. FS is what the button says. And what it can do is it can separate the fluid from the fat.